Muscle loss and joint pain are not just a normal part of aging. It's a slow decline that robs people of independence, dignity, and quality of life. In the United States, millions of seniors report limited mobility, daily stiffness, or even inability to climb stairs without assistance. But the heartbreaking part? A huge number of these people could avoid that outcome if they simply knew what to do. If you're from the United Kingdom, Canada, or Australia, the pattern is the same. Weak legs, aching knees, and fragile hips are not just about aging. They're about ignoring the body's most critical needs. This message is urgent. If you're over 60, you must take this seriously before it's too late. The human body loses up to 8% of muscle mass every decade after the age of 30, and this rate doubles after 60. This is called sarcopenia, and it's one of the most dangerous yet overlooked conditions among older adults in the United States healthcare system. It's not classified as a disease by most insurance providers, and yet it leads directly to falls, fractures, and hospitalizations that completely change lives overnight. Picture this. A man in his 70s from Texas used to walk a mile every morning. Over 5 years, his legs grew weaker, and one day, getting out of a car caused his hip to crack. Not from an accident, just from standing up. His story isn't unique. Hundreds of thousands face the same fate because muscle loss silently chips away at stability, posture, and joint function. Strong muscles are the single most protective factor against falls. The #1 cause of injury-related deaths in seniors in the United States. In Canada, nearly 1 in 3 seniors falls each year. Joint pain follows close behind, usually beginning with something minor like stiffness when waking up. But here's the thing. Stiffness is a warning sign, not a harmless symptom. It's your body telling you that inflammation and instability have started to take over. And when joints become unstable, the muscles around them weaken even faster. This cycle is deadly. If you're feeling weak when getting out of a chair, if your knees crack when walking downstairs, or if you avoid lifting things because of joint discomfort, your body is already declining. Waiting will only make it worse. The #1 thing seniors must start doing is progressive resistance training. Not body sculpting gym workouts, but science-based movements that stimulate muscle fibers and stabilize joints. This kind of training has been proven in dozens of clinical studies in the United States to reduce arthritis symptoms, improve bone density, and regenerate muscle even in people over 80. You don't need fancy equipment. In fact, body weight exercises like sit-to-stand movements, wall push-ups, or resistance band routines have been shown to be equally effective for maintaining and regaining strength. In a U.S. clinical trial, seniors who performed 20 minutes of structured resistance exercises 3 times a week improved leg strength by up to 180% in just 12 weeks. That kind of improvement can mean the difference between walking unassisted or using a walker, but muscle growth in seniors doesn't happen just because you move. You need the right fuel, and this is where most fail. Protein consumption in older adults is shockingly low. The standard diet in the United States, especially among seniors, is carbohydrate-heavy and protein-deficient. The average senior consumes only 50 to 60 grams of protein per day, which is far below the 0.8 grams per pound of body weight recommended by leading geriatric nutritionists. Without adequate protein, your body simply cannot rebuild muscle tissue, no matter how much you move. Think about that. You could be walking, stretching, lifting, and still getting weaker because you're not feeding the repair system. The situation gets even worse with joints. Seniors often rely heavily on non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, to manage pain. In the United States, they're prescribed widely and even taken over the counter daily by seniors trying to push through their discomfort. But these medications don't fix anything. They temporarily dull pain while allowing cartilage damage to progress underneath, not to mention the serious risk of stomach bleeding and kidney issues with long-term use. Meanwhile, critical nutrients like collagen, hyaluronic acid, MSM, and glucosamine are often completely missing from the daily routine of most seniors. These are the building blocks of joint repair, yet they're ignored by many general practitioners. In the United Kingdom and Canada, unless the patient asks specifically for joint support options. Let's talk about collagen, specifically type 2 collagen, which makes up the bulk of cartilage tissue in the joints. Research published in U.S. medical journals shows that seniors supplementing with hydrolyzed type 2 collagen for 90 days reported significant improvements in joint pain and range of motion, especially in the knees and shoulders. In one double-blind U.S. study, seniors using 40 mg of type 2 collagen daily reported a 33% decrease in joint stiffness compared to the placebo group. But it doesn't work like a drug. It works over time by giving the body the raw materials. It needs to rebuild damaged cartilage. That's why so many give up too early. They expect instant relief, but healing takes time and consistent intake. You also cannot talk about joint health without addressing vitamin D3 and magnesium. 2. Critical nutrients that influence calcium regulation, nerve function, and inflammation. In the United States, it's estimated that over 40% of adults over 60 are deficient in vitamin D. Without vitamin D, calcium cannot be absorbed properly, and bone and joint degeneration accelerates. Low vitamin D is also associated with increased fall risk and poor muscle coordination. Magnesium plays a direct role in muscle contraction and relaxation, and deficiencies lead to cramps, fatigue, and worsening arthritis symptoms. Seniors who take a high-quality D3 and magnesium combo often report a marked reduction in daily aches and more stable movement within just weeks. What about omega-3s? In Canada and Australia, doctors have started prescribing high-dose omega-3 fatty acids from fish oil to patients with joint pain and inflammation. Studies from the United States show that omega-3s reduce levels of interleukin-6, IL-6, and C-reactive protein, CRP, the two major inflammatory markers linked to joint damage and muscle wasting. Seniors who consume just 2,000 mg of EPA and DHA daily experience noticeable improvements in joint function and energy levels. And yet, most seniors in the United Kingdom don't even consume fish more than once a week, let alone high-dose omega-3s. These are not optional nutrients. They are essential tools in the fight against age-related decline. And here's something rarely discussed by general practitioners, but absolutely crucial: balance and proprioception training. As the body ages, not only do muscles weaken, but the neuromuscular connection deteriorates. That means your brain's ability to sense and control movement fades, which leads to shuffling, missteps, and eventually dangerous falls. In the United States, more than 800,000 seniors are hospitalized each year due to fall-related injuries. Yet simple balance training, like standing on one foot or using a stability pad for a few minutes daily, can rewire the brain-muscle connection and dramatically reduce fall risk. Seniors who engage in basic balance routines at home build strength not just in muscles, but in the brain's control over those muscles. Sleep also plays a silent but massive role in muscle and joint health. Without at least 7 hours of deep sleep, the body cannot release enough growth hormone and testosterone, both of which are necessary for tissue repair. In the United States, insomnia among seniors is almost epidemic. High stress, poor blood sugar control, and medications all contribute to fragmented sleep. That means joints never truly recover, and muscles continue to break down. Addressing this means cutting down on caffeine after 2 p.m., managing blood sugar swings with complex carbs and protein at dinner, and using natural sleep aids like melatonin or magnesium glycinate when needed. Without sleep, every other effort becomes less effective. Hydration is another critical factor ignored by many. Dehydration in seniors is dangerously common, especially in the United States, where high sodium intake and medications like diuretics accelerate fluid loss. Joint cartilage is 70% water, and when hydration drops, the cartilage stiffens and becomes brittle. Muscles also become less pliable and more prone to injury. A general rule for seniors is to aim for at least 2 liters of water per day, ideally infused with electrolytes if using medications that affect fluid balance. You should not wait until you're thirsty. By then, damage has already started. Stretching. Routines, often seen as optional or extra, are in fact essential. In places like Australia, physiotherapists are now required to include daily stretching prescriptions for seniors recovering from injury. Static stretches like hamstring holds, calf stretches, and shoulder openers reduce chronic tension, improve joint alignment, and increase blood flow. In a United States pilot study, seniors who did 15 minutes of stretching after resistance workouts saw 45% fewer mobility issues within 3 months. This matters because tight muscles pull on joints and increase wear and tear, especially around the knees, hips, and lower back. A massive, often underestimated factor in muscle and joint decline among seniors in the United States is chronic low-grade inflammation caused by diet. The typical American diet, loaded with refined carbohydrates, hydrogenated oils, and processed meats, is a breeding ground for inflammation. This affects not just heart health or blood sugar, but deeply impacts muscle recovery and joint fluidity. Inflammatory foods increase the body's cortisol production, which breaks down muscle tissue and accelerates cartilage erosion. If you're over 60 and still consuming white bread, sugary snacks, sodas, and processed oils like soybean or canola oil, you're accelerating your own breakdown. The standard American diet, SAD, is literally making people sad, stiff, and immobile. Seniors must transition toward anti-inflammatory eating. Lean proteins, wild fatty fish, avocados, olive oil, berries, leafy greens, and fermented foods like sauerkraut and kefir. Not because it's trendy, but because it reduces swelling inside joints, enhances nutrient absorption, and gives the body a fighting chance to heal itself. In the United Kingdom, dietary shifts among seniors have shown real impact on joint flexibility and energy levels when paired with proper movement. But even with good food and training, some seniors still fail to make progress. And one reason could be gut health. If your digestion is compromised, your body may not be absorbing the amino acids, collagen, and minerals needed to build and repair tissues. Many seniors have low stomach acid and enzyme production, leading to bloating, gas, and poor nutrient uptake. Supplementing with digestive enzymes and probiotics, especially after meals, has been proven in clinical studies to improve amino acid absorption and reduce systemic inflammation. Seniors from Canada who integrated gut healing protocols like bone broth, L-glutamine, and prebiotic fibers into their routine showed improvements in both strength and mobility over a 60-day period. Fix the gut, and the whole body becomes more responsive to nourishment. Some seniors think walking is enough, but walking alone is not resistance training. In Australia, fitness experts who work with older populations warn about this misconception. Walking is great for circulation, but it doesn't apply enough tension to muscle fibers to stimulate growth. It won't rebuild atrophied muscles or stabilize failing joints. To achieve those results, exercises must involve controlled resistance, gradually increased over time. Resistance bands, light dumbbells, or even water bottles at home are enough if used properly. Seniors must perform these movements to the point of muscle fatigue. That's where growth happens. For example, using a chair for stability, a senior can perform wall squats or step-ups until the legs feel challenged. This is not dangerous, it's necessary. Avoiding effort is what leads to disability. Real improvement begins when the muscle fibers are pushed, broken down slightly, and then rebuilt through rest and protein. Hormones also play a huge role in this conversation, especially testosterone and estrogen, which are vital for muscle retention and joint lubrication. In both men and women, these hormones decline after 50, and the effects are profound. Testosterone aids in muscle protein synthesis, while estrogen keeps ligaments and cartilage elastic. Hormonal imbalances can make even the best diet and exercise plans less effective. In the United States, some forward-thinking doctors specializing in integrative or functional medicine now recommend bioidentical hormone replacement therapy, BHRT, for seniors dealing with extreme fatigue, rapid muscle loss, and chronic joint issues. These therapies must be medically supervised, but in controlled cases, they've reversed years of degeneration. Seniors from Canada who started low-dose testosterone therapy alongside a strength training routine often report improved posture, muscle tone, and energy within 90 days. It's not about turning back the clock. It's about reclaiming basic function and vitality. Another overlooked area is mitochondrial health. Mitochondria are the energy factories of cells, and as we age, their function drops significantly, especially in skeletal muscle. Weak mitochondria mean poor recovery, low energy, and muscle atrophy. In the United States, researchers have found that supplementation with CoQ10, alpha-lipoic acid, and PQQ can re-energize aging muscle cells. These compounds support mitochondrial biogenesis, the creation of new mitochondria, which directly leads to better endurance and strength output. Seniors often describe a new level of energy and less joint soreness when taking mitochondrial support supplements daily. This isn't fringe science. It's rapidly becoming standard advice in longevity-focused practices across the United Kingdom and Australia. Flexibility training must not be ignored. As tendons stiffen and fascia tightens, joint range of motion decreases and pain increases. Daily dynamic stretches, like arm swings, hip circles, and spinal rotations, wake up the joints and stimulate synovial fluid production. This fluid is critical. It keeps joints moving smoothly and reduces friction. Seniors in Canada who perform just 10 minutes of dynamic stretching in the morning often report greater ease of movement throughout the day. This isn't a luxury, it's a necessity. It should be as automatic as brushing teeth. Lack of mobility means lack of independence. Simple flexibility routines can reverse frozen shoulders, reduce lower back pain, and even improve posture that's become hunched from years of sedentary living. Another major trigger of joint degeneration is blood sugar dysregulation. High blood sugar leads to glycation, where sugar molecules stick to proteins and damage collagen in joints. This is a hidden cause of arthritis-like symptoms, especially in seniors with type 2 diabetes or prediabetes, which are rampant in the United States. Managing blood sugar through low glycemic meals, berberine supplements, and meal timing strategies like early dinners can significantly lower joint inflammation. Seniors in the United Kingdom who adopted time-restricted eating windows between 10 a.m. and 6 p.m. experienced fewer stiffness issues and more consistent energy throughout the day. Blood sugar isn't just a diabetes issue, it's a joint health issue. Breathing patterns also change with age and affect muscle and joint health in subtle but significant ways. Poor posture leads to shallow chest breathing, reducing oxygen supply to tissues. Muscles and joints rely on oxygen for repair. Deep diaphragmatic breathing can enhance oxygen delivery, reduce stress-induced cortisol, and improve sleep quality. In Australia, senior fitness classes are beginning to integrate breathwork to boost performance and recovery. Seniors who practice 5 minutes of controlled breathing before workouts see better endurance and less soreness the next day. That's how powerful oxygen is. It costs nothing, but its correct use can drastically improve outcomes. There's a psychological element to this too. Many seniors in the United States report fear of movement, especially after an injury. This fear is valid, but letting it dominate leads to deconditioning and rapid decline. A study from Harvard Medical School revealed that seniors who received physical reassurance therapy involving education, coaching, and gradual reintroduction to movement regained confidence and significantly improved mobility. Seniors from Canada who participated in group resistance classes reported lower anxiety, more motivation, and better strength gains compared to those training alone. Social support and emotional reassurance are powerful tools in rebuilding muscle and joint strength. Isolation leads to deterioration. Community leads to resilience. There is also an epidemic of magnesium deficiency across older adults in the United States, caused by poor soil quality, water filtration, and heavy medication use. Magnesium is involved in over 300 enzymatic reactions, including those related to muscle contraction and nerve communication. Low magnesium leads to cramps, fatigue, joint stiffness, and even mood disorders. Supplementing with magnesium glycinate or citrate has been shown to improve sleep, ease restless legs, and support joint repair. Seniors from the United Kingdom who corrected magnesium levels experienced better flexibility, improved walking speed, and more restful nights, proving how this one mineral can impact so many systems. Lastly, hydration with electrolytes, not just plain water, is essential. Sodium, potassium, and chloride levels control muscle contractions and nerve impulses. Seniors using diuretics or blood pressure medications often flush out these minerals unknowingly. In the United States, seniors end up in emergency rooms every year with muscle weakness and heart irregularities due to electrolyte imbalance. Sipping water with electrolyte tablets or coconut water during the day can restore balance and protect both muscle and joint function. Even mild dehydration causes cartilage to grind and muscles to cramp. Preventing that is simple, but often forgotten. This is not just about aging gracefully. It's about standing up from the toilet unassisted. It's about picking up a grandchild without wincing. It's about walking down the stairs without fearing a fall. Seniors in the United States, United Kingdom, Canada, and Australia must begin to see this decline not as inevitable, but as a preventable and reversible process, if they act with urgency, consistency, and the right tools.